तुषारहारधवला या शुभ्रवस्त्रापुता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करप्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा।
Now we have Dr. Roshni Anirudhan, beloved HOD of Department of Kaumarabhritya, Government Ayurveda College, Trivandrum, for welcoming all to the function. We welcome you, ma'am.
Thank you. Respected dignitaries who had gathered online and the delegates who are present for the occasion. Actually, it's a dream come true for the Department of Kaumarabhritya. Every year we dream of our CMEs who all invited lectures. We can enrich our skills, which topic we should discuss. And actually, it's a 1 year long dream we cherish in the department that we plan for a CME. So topic, the guest, everything counts a lot. It's the effort of the entire department that the CME is hosted online. In the initial years, we were hosting the CME offline, but we could cater only like 30 or 50 delegates. Then, and also due to some bit financial constraints, we could expand our platform online, catering more Kaumarabhritya fraternity and the national level as well. And this year, we are blessed with the presence of fraternity from Prasuti Tantra and also from the anatomy department. Maybe the uniqueness of the topic has invited more delegates. And the registration has crossed almost 385. Maybe the others will be joining soon. So entering into my duty. It's my privilege to welcome the dignitaries, respected superintendent of our college. Even though we are having our institute is spread in 3 campuses, the superintendent of Dr. Sunil Kumar sir, HOD of Shalakya department, a beautiful combination of an academician, a researcher, and also a very good clinician. And he has expressed his skills in all the 3 platforms in a unanimous or a unique way. So we are blessed to have him as the presiding over this function. And in the name of the department and all who are gathered here, we welcome you, sir, and we extend a heartfelt welcome for you, sir, for the CME. And our principal, beloved principal, Dr. J.G. Madam, she is the first person to show a green card for all the activities which we put forward. And this CME also hosting it in the national level and scheduling it in a 3-week long CME. We didn't face a single objection from the office of the principal or from her desk. So it is a wholehearted support she extends to us, our department, in a loving manner. That is the inspiration for us to work more and more. So in the name of the department and all the delegates gathered in the CME, we extend heartful welcome for you, ma'am. And our campus. Thank you. And our campus, as I said earlier, Government Ayurveda College, Trivandrum is having 3 campuses. And our Prasuti Tantra HOD, Dr. Maya Balakrishnan, is serving as the superintendent of WNC campus. So she is also present here to bless our occasion. And a loving welcome to you, madam, as well. Dr. Mini S. Muralidhar, Head of the Department of Kaumarabhritya of Kannur Ayurveda College, is present here to bless us. She is our own faculty actually. In Kerala, in between the Ayurveda colleges, we have a turn of transfer going on. That's why she is there at Kannur. But still, she is our strength. The platform is hosted by the Government Ayurveda College Kannur, which is serving us throughout this entire 21 days to have a host a discussion. And even though she is there at Kannur, she is with us in each and every activity. So from each one in the department, we have welcome you, ma'am.
Thank you.
Dr. Shahina Mole, as the representative from the Prasudidantra Striroga fraternity, is the embryology is the common topic of interest for the Prasudians and also the Cabians. So the topic was actually drafted as per the syllabus also. So the Prasudi department is there throughout in the planning of the CME. To give our blessings as a representative of the Prasudi Tantra department, we welcome you, Shaina madam.
Thank you.
Again, Dr. Seema T.S. is there as a representative of the Rajana Sharira department from Government Ayurveda College, Tripunithura. We are blessed to have the representatives from all the colleges, government colleges of the state and also outside the state. Being my classmate, I have a special love inside for her as well. So, as a representative of Rajana Sharira department, we welcome you, ma'am, Dr. Seema, ma'am.
Thank you.
Dr. Bijoy is, though he is not physically present now, he is the pediatrician of WNC, allopathic from the modern science. He is there in all our activities. WNC is a hospital where we parallelly have both an allopathic section, a modern medicine section, and an Ayurvedic OP and IP running parallelly. So he is leading that allopathic pediatric session, and he is there in each and every activity, and he has helped us a lot to fix up the invited lectures as well. So even in his absence, I extend a heartful welcome to you, sir. And representatives from PGSA and PGDSA are there. As everyone know, PGs are our strengths. So all the activities in the department, they are adding the flavor to it. And this CME is actually an effort of their hard work. For preparing the CME, they are hosting pre-CME papers, discussing upon the core of this subject for last 1.5 months. Discussing upon each nook and corner of this topic in presenting it in the platform, and for this going on for the last 1.5 months. So it's a hardcore effect they are putting in front of you in terms of pre-CME papers, and sharing even the PDF for each and every one in the delegates, which can form a prerequisite or for the CME to happen, so that we are planning to CME to go into such a level that it can satisfy the needs of a researcher as well. So hats off to the PGs and PG diploma students of our department for the hard work and sincere attitude. Thank you, dears. Representatives are the from PGSA and PG diploma. Dr. Arundhati is the, and Dr. Shilpa Peter is the. We welcome you, doctors, for this CME. And house surgeons, again, our power in handling the clinical cases, and also case recording is done by them. So Dr. Kirti is there representing the House Surgeons Association, and and Miss Alina Mariam is representing College Union. So welcome you all for the inaugural function. And a word about our team, our teaching faculty in Kaumarabhritya. We are 4. Dr. Sohini, Dr. Lakshmi, and Dr. Arati. And it's a single-handed, unique work from our side that if one dream of thing, and they ensure that it's made into reality. Popping up with newer ideas every day, it's really a charm to work with them. They make a second home in the department. So it's a work attitude that build up in the department, which is reflected in the CME as well. So in official norms, I am welcoming Dr. Sohini, Dr. Lakshmi, and Dr. Arathi to this department. Sorry, to the CME, and not even though last, but the most important are the delegates who are the beneficiaries of the CME. We also count us as a delegate of the CME because we are going to benefit, or we are going to enrich our knowledge and the skills and we are going to plunge in the depth of embryology and genetics. Though we are getting a lot of genetic cases and embryological derangement, that knowledge need to be sharpened and deepened. So each and every delegate who are interested in this deeper field are welcome to this CME. So, one and last, I welcome one and everyone to make a CME a grand success. Thank you.
Thank you, ma'am. Next, on the behalf of Department of Kaumarabhritya, we welcome Dr. Sunil Kumar Sir, respected Superintendent of Government Ayurveda College, Trivandrum Hospital, to deliver the presidential address. We welcome you, sir.
Respected Principal Dr. J.G., who is going to inaugurate the CME program. Respected Head of the Department of Kaumarabhritya, Dr. Roshni Andrew, respected dignitaries, respected faculties, respected delegates, and dear PG scholars and the supporting staff of the CME program. Good evening to all. First of all, I would like to congratulate the Department of Kaumarabhritya for organizing a mega event. It is a mega CME. It is a national mega CME in genetics and embryology in the name of Srishti for the new generation and for the promotion and propagation of Ayurveda. Here in this CME, it is a special CME. It is having multi benefits. One thing, it is having a free CME that is conducted by the PG scholars of Kaumarabhritya department, having 16 sessions. That also will help a lot to study and understand and discuss about the genetics and embryology. And then 20 sessions, that is the national CME, that is by faculties from all over the medical colleges. Then Rajiv Gandhi Center for Biotechnology and from the Home Department of Kaumar. It's multi benefits. One thing, this is arranged in a way that is starting on 27th and ending on 20. That means nearly 24 days. Usually we used to do within 3 or 4 days we will conduct this CME. At that time, we will not get much time for studying and planning and discussion. Here it is arranged in such a way that those who are participating and faculties and delegates, they can do their routine duties. At the same time, after that, they can attend the CME also. That is a good idea. Again, those who are participating and delegates, they are getting enough time to read, study, and for discussion. So the planning is very, very good. And I'm not talking more, only one advice, one suggestion to the delegates. Those who are attending the CME should attend in time and should be in the CME program full time. And one more thing, I wish all success for this CME program and special congratulations to Roshni Andrew, the head of the department, for organizing such a program with the help of all the faculties and PG scholars. Wish you all success for this program.
Thank you, sir. Moving on to the inaugural address, we welcome our respected Principal of Government Ayurveda College, Trivandrum, Dr. J.G. ma'am. Welcome, ma'am.
Thank you. Very good afternoon or good evening to all. most respected our hospital superintendent Dr. Sunil Kumar, our team captain Dr. Roshni, followed by Dr. Sohini, Dr. Lakshmi, and Dr. Arati. And our faculty, Dr. Mini is also there, Dr. Seema is there, Dr. Shahina is there, everyone I can see here. But this is my first experience in inaugurating such a CME. It lasts for almost 20 days. That is from 24th to 27th to 20th of February. That's a novel idea, and I am very much interested, and I am happy to hear that it's a long term CME. And as Dr. Sunil Kumar said, this is a very good approach, I think. In a CME for a 2 days or 3 days, everything is all gone by that 3-4 days, that's all. But there is enough time to recollect and revive the data you received, the knowledge you received, everything from each and every classes. And it is going through your this thing classes and all. It is I see this is a health beautifully woven CME with three aspects. One is Sudhi Tantra, Kaumarabhritya, and also Rachana Sharira. That we need. That is the need of this era. And Srishti is a very good name. Whoever suggested, congratulations to that person who suggested this name Srishti to the CME. And I'm wishing you all the best. And I hope the CME will be a grand success. And with all heartedly, I declare this CME inaugurated. Thank you. Thank you all.
Thank you, ma'am. Before starting the CME, it's important for all of you to know the sessions we are planning to conduct and who all are the presenters and details on the time and venue. We welcome Dr. Lakshmi ma'am to deliver us the CME schedule. Over to you, ma'am.
Okay. So, good evening, all. Respected Principal, Superin ma'am, Superin sir, HOD Roshni ma'am, and Mini ma'am, and all other respected teachers and my dear delegates. So, as you all know, the Department of Kaumarabhritya Government Ayurveda College Trivandrum has been conducting CMEs for a long time. And we have covered almost all the topics like epilepsy, autism, cerebral palsy, and learning disability. I don't know, almost all the topics we have already covered the clinical topics. So when we were thinking about the CME, actually, we thought we will go on with a new topic, not a new topic, but a topic that has been not been so much covered by other institutes. And I don't think there are that much CMEs conducted in the topic of embryology and genetics, particularly by any Ayurveda college anywhere in India. So with pride itself, I must say that we have planned it like that. It is an actually 18-day long session. We have an 18-day long session starting from Jan 27th till February 20th. And with a 1-day break we have around on February 12th. So due to the the constraints from the delegate, from the resource persons, that day was just a gap. But we have actually 2 sessions in 2 days on the 11th and February 4th. We have 2 sessions in the afternoon from 2 to 4 p.m. and in the evening from 6 to 8 p.m. So I hope the delegates will all be interested in the topic, because it is not a comprehensive CME. It is actually an elaborative CME that we have covered, that we want everyone to be get a thorough knowledge of the topic, that is embryology and genetics, after this CME. So that is why actually we have a very we are very thankful to our particularly the resource person for embryology, that is Dr. Geetha Jayachandran ma'am, the teaching faculty from the Government Medical College Paripally, who has actually wholeheartedly supported us with 6 classes on embryology. So so that is actually, we are lucky that we got such a resource person, and she is taking 6 classes for embryology for all of us throughout India. And another faculty we have Dr. Vinita ma'am from identify the dysmorphic features and how a genetic testing should be conducted in children having dysmorphic features, and what test you have to suggest. As you all know, genetics is the what developing field, and in the coming years everyone will be forced to do the genetic testing, isn't it? So that is why in this way, and we have actually covered what the biochemical aspects as well as the clinical aspects. Both are covered in this CME, and we have Dr. Moinak Banerjee sir from RGCB. He is actually a very senior faculty technology, and he will actually cover us with pharmacogenetics, which actually is the personalized medicine. So he will throw us light into that topic. And we have actually an international faculty from US, from New York. He has actually, Dr. Vikas Kumar, he has actually done research in the field of Rasayana and genetics. So he will also throw us a light into the research aspects and also the the biochemical aspects in the aging mechanisms, etc. In the genetic aspects. Okay, so in that way we have actually around 16 resource persons. We have a neonatologist also, and we have Dr. VK Kori sir from NIA from Jamnagar, and also ma'am, the Prasudi ma'am from the NIA Jaipur. So both will actually deal with the Ayurvedic aspects, and also other resource, the 4 faculty from our department. We also will be sharing the the preventive aspects as well as the management of genetic disorders. So I think with this I will conclude, and I hope all will have a complete idea of embryology and genetics after this 1 month long CME, and I hope everyone will be with us, and we expect wholehearted support, as well as we expect actually discussions, fruitful discussions from the delegates, so that towards the end we will have a clear-cut idea of genetics that is being explained in Ayurveda, as well as the clinical aspects and the newer advancements in the field of genetics. So thank you all. Welcome you to the CME.
Thank you, ma'am. Moving on to the felicitation, we welcome Dr. Maya Balakrishnan, our beloved Superintendent of W&C Hospital, for the felicitation speech.
Teacher, please unmute, ma'am.
Am I audible now? Respected children, sir, Jay ma'am, dear Roshni ma'am, Dr. Mini, Dr. Shahina, Dr. Seema, all my dear colleagues, faculty, the dignitaries and other dignitaries and delegates, and all our dear students. Indeed, I am very honored to be invited for delivering this felicitation for this marathon CME. Actually, as all of them said, probably this is first of its kind here, which we are organizing in this college. Anyways, I really congratulate Dr. Roshni and Dr. Lakshmi, Dr. Sohini, Dr. Arati, and all the PG and PGT students for organizing this. And from what I have heard of the topics, I understand that each nook and corner has been covered. So indeed, it will really be a wonderful experience actually of learning, a learning experience. Actually, when it comes to gynecology, because I am an Ayurvedic gynecologist, embryology and genetics actually are very important, or they have a very important impact when it comes to the practice of gynecology. Because as you know, many conditions like polycystic ovarian syndrome, endometriosis, adenomyosis, fibroids, many reproductive cancers, all of them have a genetic basis. And actually, rather than the management of these conditions, prevention of these conditions, I think, should actually start when right from the time when a child is planned to be conceived. Even now, we do not exactly know what underlies the development of these conditions. Actually, when it comes to development of a child, Ayurveda is very eloquent as to the practices related to conception and its care, because we know that from Rajaswalacharya to, it's a cycle actually. So like if we are starting from Rajaswalacharya of a girl child, from Rajaswalacharya to Vivaha Vidhi, then Maithuna Vidhi, then actually the Patya of Garpini Paricharya, etc. All these are actually, each and every aspect, Acharyas are very careful when they are talking about how a mother should be, how a couple should be, and everything is actually dealt with in great detail. You should not do that, you should not do this. There are so many do's and don'ts, and multifactorial, I should say, are the factors probably that come into play in development. But we exactly do not know why exactly all this is being said. Many things probably we understand, but there is a lot of knowledge gap, and these knowledge gaps can be filled only if we have the real knowledge regarding development, genetics, etc. So I really congratulate you, Dr. Roshni, for having thought about all of us and actually planned this CME. I wish this CME all success, and I hope that I'm sure that all of you who are attending the CME will really be benefited, because all of you might be having a lot of doubts regarding these topics, and I'm sure that by the end of this marathon session, you will all be much more elevated and enlightened when it comes to genetics and embryology. I wish the CME all success. Thank you once again for inviting me on behalf of the Department of Prasudha and Sriroga Trivandrum. Thank you, Dr. Roshni, and the entire team, Kaumarabhritya. Thank you.
Thank you, ma'am. Now we have Dr. Mini S. Muralidharan, ma'am, Professor and HOD, Department of Kaumarabhritya, Government Ayurveda College, Kannur, to deliver the felicitation speech.
Am I audible?
Yeah,
Am I audible?
perfect, Chechi.
Good evening, respected dignitaries, dear colleagues, faculty members, doctors, and PG students. It's indeed a privilege and honor to felicitate the CME Srishti, organized by Department of Kaumarabhritya, Government Ayurveda College, Trivandrum. I congratulate Dr. Roshni and the entire team, including Dr. Sohini, Dr. Lakshmi, Dr. Arati, and PG scholars for this initiative. And your topic selection is wonderful, because genetic disorders are on the rise nowadays, and the overall prevalence of birth defects in India is 64.4 per thousand live births, and almost 70 million individuals in India is affected with rare genetic disorders. And this CME is going to cover each and every aspect of genetics and embryology, I think. And coming to the speakers, you have wonderful speakers, renowned experts in the field, providing an excellent platform for knowledge sharing and discussion. Hats off to KBN's Trivandrum. Once again, my hearty congratulations to the entire team. I wish a successful and enlightening CME on behalf of Department of Kaumarabhritya, Government Ayurveda College, Kannur. Thank you. Thank you all. Thank you.
Thank you so much, ma'am. Now we call upon Dr. Shahina Mall, Professor and HOD, Department of Prasudi Tantra and Stree Roga, Government Ayurveda College, Tripunithura, for felicitating the event.
Good evening, all. Respected Sir, J teacher, dear Roshni, Dr. Lakshmi, Dr. Maya Balakrishnan, Dr. Mini Smrulitharan, Dr. Seema, and all other delegates, and my dear students and PG students, a warm good evening. First of all, I say thank you to give me an opportunity to facilitate the occasion. The organizers have done an outstanding job in curating a comprehensive and engaging program, CME on genetics and embryology. I hats off all the Department of Kaumarabhritya, Government Ayurveda College, Thiruvananthapuram for conducting pre-CME sessions and make detailed PPT presentations for quick refreshment of the topic. I think the pre-CME session ensure very smooth and enriching learning experience during the CME. Once again, I appreciate Dr. Roshni and team for securing such esteemed speakers and creating a valuable learning opportunity for all of us. I wish all success for this program and thank you. All the best.
Thank you, ma'am. Now we call upon Dr. Seema T.S., Professor and HOD, Department of Rajana Sharira, Government Ayurveda College, Tripunithura, to deliver the felicitation speech.
Am I audible?
Yes, perfect.
So, respected dignitaries and dear delegates, a warm evening to one and all. Actually, I'm representing the anatomy department. So, we are the ones who are introducing the students to this subject, embryology. But actually, we are dealing only with the general embryology. We don't go to the details of the system-wise embryology, even though I think that this is actually an opportunity for us to freshen up our knowledge and also to enhance this knowledge in this particular subject. And actually, this pre-CME sessions, it is actually, I think it is the hallmark of the Kaumarabhritya department itself, because in the previous years also, we have also been part of these CME sessions. So I was thinking of all those things. And we know fairly well it is very difficult to organize even a one-day CME, and you people are doing it for a period of 3 weeks. Hats off to the department for that. And about the topic also, I think that it is a very relevant topic, because we have seen in this new PG syllabus itself, a new department as Ayurveda biology has been introduced. And when we are going through the topics, we can see that our genomics has been given more importance in that particular subject. Okay, so the genetic counseling and this the concept of bija bhaga, so everything has to be explained on the line of genetics. So it is clearly explained in that. So I think it is actually the need of the hour that we should have a to have a clear-cut knowledge about all these things. And so I actually appreciate the department for selecting such a topic. And thank you for giving me an opportunity for this felicitation. And I congratulate Kaumarabhritya team, and I wish a grand success for the whole webinar series. Thank you.
Thank you, ma'am. Next, we invite Dr. Bijoy S., pediatrician, Government Ayurveda College Hospital for Women and Children, Pujapura. Due to some unavoidable personal reason, sir couldn't join us. Instead, he sent us a video to felicitate the event. We will be playing on behalf of him.
Good evening, doctors. I am Dr. Bijoy, pediatrician, WNC Hospital, Pujapura. I am really delighted to know that our KB team of GAC TVM is conducting a national CME on embryology and genetics. Our KB team headed by Dr. Roshni, Dr. Lakshmi, Dr. Sohini, Dr. Arathi, always come up with ideas, innovative ideas and topics related to neurodevelopmental disorders. Now they selected a topic, embryology and genetics, which is also related to that, closely related to that neurodevelopmental area. And the CME on this embryology and genetics, which paves informative insight into the field. I feel privileged to express my heartfelt congratulations to each and every members of the KB family, and excellent speakers we got. I congratulating them also, and thank you. Looking forward for the informative sessions. Thank you.
Next, we have Dr. Seemaja S., President of Agila Kerala Government Ayurveda College Adhyapaka Sanghadana, Trivandrum Unit, to deliver the felicitation speech.
Respected Principal, other dignitaries, Dr. Roshni, my friend, Dr. Lakshmi, Dr. Sohini, and other faculties and delegates. Actually, it is an interesting topic. Genetics and embryology, it's a major area which needs our immediate attention and understanding, I think. And many a times in clinical scenario, we are reluctant to deal with such cases confidently, or we may be handling such cases, but and even some results are also getting, but not able to explain the mode of action in a better way. So I think it's a good opportunity for all the delegates to have a better understanding of this topic. And so I congratulate all the uh, faculties behind this spectacular program. I would like to extend best wishes to this program on behalf of Akhila Kerala Ayurveda College Adhyapaka Sanghadana Trivandrum Unit, and I think this is can be called as a certificate program rather than a seminar or CME, because it has crossed all the limits, I think. All the best to the entire team. Thank you.
Thank you, ma'am. Next, we call upon Dr. Arundhati P., PGSA President, for the felicitation.
So, thank you. Good evening to all. So, it gives me much pleasure to be a part of this occasion, Srishti, the National CME on Genetics and Embryology, organized by Department of Kaumarabhritya. So, genetics and embryology are the foundation science that unlock many mysteries of the life itself. So, it might give very insight to the principles of the Garbha Vijnana, Garbha Samskara, and I would like to congratulate the Department of Kaumarabhritya for envisioning such a beautiful CME. And I sincerely my heartfelt felicitations to everyone associated with CMA, and from the part of users and myself, I extend this CMA very resounding success. Thank you.
Thank you, Dr. Arundhati. Now we have Dr. Abarna, second year PG scholar, Department of Kaumarabhritya, and executive member of PGSA, for few words.
Good evening. Respected Principal, JG Madam, Supran Sir, Sunil Sir, our beloved HOD Roshni Ma'am, and all other faculties and delegates, I extend my warm felicitation on behalf of Department of Kaumarabhritya and PGSA Government Ayurveda College Trivandrum for successfully conducting the Srishti National CME on genetics and embryology. Thank you.
Thank you, Dr. Abarna. Now we have Dr. Shilpa Peter, executive member of PGDSA, to speak a few words.
Good evening all, respected dignitaries and esteemed colleagues. On behalf of PGDSA, it is my privilege to extend our heartfelt congratulations and warm felicitations to all the organizers, speakers and participants of National CME Srishti organized by Kaumarabhritya Department. May the insights shared will inspire us to expand our horizon and integrate these advancements into our practice. Thank you and best wishes.
Thank you, Dr. Shilpa. Now we call upon Dr. Kirti MV, President, for the felicitation speech.
Good evening, all. Myself, Dr. Kirti, on behalf of the House Surgeons Association 2024-2025. It is my honor to felicitate that organizing committee, that is the Department of Kaumarabhritya, and the speakers and participants of Srishti, National CME on Genetics and Embryology. I wish this program brings together experts and practitioners to share knowledge and explore recent advancements and discuss the applications of genetics in patient care. Once again, I take this chance to appreciate the efforts of each and every one of you. Thank you.
Thank you, Dr. Kirti. Next, we call upon Ms. Alina Mariam Valayil, Vice Chairperson, College Union, Government Ayurveda College, Trivandrum.
Good evening, my respected teachers, dignitaries, and delegates. It's an honor to be here today at this prestigious and elaborative CME event on genetics and embryology. I would like to use this opportunity to congratulate Kaumarabhritya department for the efforts that they undertook for arranging this program, and I extend my wishes and support of college unit to the whole department and hope that the CME will help us to learn about new developing areas of the field, and I wish this program is a great success. Thank you.
Thank you, Alina. To conclude this remarkable event, we have Dr. Sohini S., Associate Professor, Department of Kaumarabhritya, Government Ayurveda College, Trivandrum. We welcome you, ma'am.
Dr. Sohini, I think you are mute.
Sorry.
Now it is okay. Now it's okay.
Okay, good evening to all. Respected Principal Dr. J.J. Ma'am, respected Hospital Superintendent Dr. Sunil Kumar sir, and all other dignitaries and delegates and PGs. So our department, the Department of Kaumarabhritya, Government Ayurveda College, Thiruvananthapuram is also organizing an interesting, wonderful topic that is genetics and embryology. So it's very important for all academicians and all clinical practitioners. So this CME, that 3-week CME, is also given a valuable insight to the practical applications of genetics and embryology in the various field of that means in the new mode of genetic methodologies and newborn screening and antenatal screening and the deep study of the embryology and concept of Ayurveda into the embryology and genetics, etc. So it's a time for a vote of thanks. First of all, I extend my sincere gratitude to Dr. S. Sunukumar, Superintendent, Government Ayurveda College Hospital for Government Ayurveda College, Thiruvananthapuram, for giving a presidential address to our 3 weeks CME. Thank you, sir. And I express my sincere gratitude to our principal, Dr. J.J. Ma'am, for inaugurating our CME and giving an inaugural address to our to the inauguration ceremony. Thank you, ma'am. And I express my sincere thanks to Dr. Roshni Anirudhan, Professor and HOD, Department of Kaumarabhritya, Government Ayurveda College, Thiruvananthapuram, and giving a welcome speech to this inaugural session. As ma'am is our faculty, ma'am is our HOD of the department, and ma'am long vision and well planned, and also with organization skill is the main factor for conducting this type of CME for our department. And officially, I express my sincere thanks to Dr. Lakshmi M.K., Associate Professor at the Department of Kaumarabhritya, Government Ayurveda College, Thiruvananthapuram, giving a detailed explanation about these coming CME programs. And I express my sincere thanks to Dr. Maya Balakrishnan, Superintendent of the Government Ayurveda College Hospital for Women and Children, Pujapura, and giving this felicitation to our CME program. Thank you, ma'am. And I would like to express my sincere thanks to Dr. Minius Muralidhar, Professor and HOD, Department of Kaumarabhritya, Government Ayurveda College, Kannur, for giving blessings to our and giving a kind words to our CME. Thank you. And I extend my sincere thanks to Dr. Shahina Mol, Professor and HOD, Department of Prasuti Tandra and Sriroga, Government Ayurveda College, Tripunithara, for giving the felicitation. And I convey my sincere thanks to Dr. Seema T.S., Professor and HOD, Department of Rajana Sharira, Government Ayurveda College, Thiruvananthapuram, for giving this for this occasion. So for the felicitation. And I convey my thanks to Dr. Bijoy, yes, a pediatrician at our hospital, and give this blessings words to our CME. Thank you, sir. And I extend my thanks to Dr. Seema Jayas, President of AKGSAS at Trivandrum Unit, for giving so kind words. And I would like to express my thanks to this member of Dr. Arundhati P, the President of PGSA, and Dr. Aparna of second year PG scholar of the Department of Kaumarabhritya and executive member of the PGSA, and Dr. Shilpa Peter, PGDSA, and Dr. Kirti MV, HSA, President of HSA, and Miss Alina Mariam Valain, the member of the College Union, for thank you for your felicitations. And I express my sincere thanks to all my PGs of my department, because their coordination and their dedicated work is also important for conducting for this lengthy 3 weeks of CME for our department. Thank you, PGs. At last, I once again extend my thanks to all delegates for participating this CME in all over India. Thank you.
Thank you, ma'am. Now we come to the end of our official inaugural ceremony. Ma'am, shall we start a scientific session, ma'am?
Please.
Ma'am, please unmute your mic, ma'am. Am I audible, ma'am?
Yeah, you are audible. Geetha madam, has she joined?
Yes, madam.
Oh, then shall we go into the session, ma'am, with a short word of introduction?
Okay. Oh, we had an elaborate inauguration. I didn't expect this much.
It's a 3-week-long CME, ma'am. That's why. And
I joined 10 minutes back, but you had a long facilitation session, and I see that 143 have joined also.
Yeah.
Okay. Today I am planning to take only the first week. It won't be that much long. It will be a short video, presentation, and following next week on next session onwards, it will be a little longer.
Sure, ma'am. Sure, ma'am. We'll slowly build it up, ma'am.
Okay.
And so they have enough time to work up at home as well.
Yes. Okay, can I share the screen?
Sure. Kritya, ma'am ne host.
Ma'am, can I give a quick brief introduction?
Sure. Please introduce. Hridya, please make ma'am the host so that she can share it.
Ma'am, it's our honor to introduce our first speaker, Dr. Geetha Jayachandran, a distinguished expert with an impressive 24 years of experience in teaching and in the field of embryology. She currently works as an associate professor in Department of Anatomy, Paripally Medical College, Kollam. We are fortunate to have Dr. Geetha leading a comprehensive 6-part series on the topic embryology, with today marking the first session. We welcome you, ma'am, to begin today's scientific session.
Okay, thank you very much for that introduction. So today we will be starting with the first week of development. So you know that the human intrauterine life, it is about 40 weeks, that is 280 days. Okay, and the intrauterine life, it is divided into embryonic period and fetal period. The embryonic period is the first 2 months, that is starting from the time of fertilization to the 8th week. This is followed by a fetal period, which is from the 3rd month to the birth. Can you hear me?
Yes, sure, ma'am.
Okay. So this embryologic period is again divided into germinal period and the embryonic period proper. And in the germinal period, starting with fertilization, it goes through certain different stages. Like after the zygote is formed, cleavage occurs, then the morula formation occurs, then the morula is converted to blastocyst, and as this blastocyst enters the uterine cavity, implantation occurs, and as implantation occurs, some cells will become trophoblasts, some cells will become the embryo proper. And finally, you have the fetal period, which extends from the 3rd month to the birth. Once the baby is out, then again some sort of development occurs, but that is postnatal development. Now, in the first week, these are the events that occur in the first week. So we have these developing zygote which undergo cleavage. Then we have been talking about the morula formation, the blastocyst formation, and starting of implantation. Okay, first we will come to cleavage. In this picture,
Excuse me, ma'am.
yes.
The slides are coming in clusters. And can you please zoom one slide, ma'am? Or put it in slideshow?
This is slideshow only.
But I can see more than 15 slides, ma'am, in a view.
Once more I will do. Now is it okay?
The same is happening, ma'am.
Ma'am, you just select one slide.
Now it is okay. First week of development slide is seen.
But side also all the slides are seen, no?
Yeah.
But this
It's
is
okay,
okay.
ma'am.
This is okay. Now what happened? Now is it okay?
Yeah, okay. Can you put it in slideshow, ma'am?
This is slideshow.
Oh, then it's okay. We'll zoom it.
Or you want the other way? This one is okay? Hello?
This one is okay, ma'am.
Okay,
If you
okay.
are adding more details, I think. Can the delegate zoom it out? Now it is okay. Now it's more enlarged.
Okay.
Now it went back, madam.
Yes, ma'am, it's okay.
Now we can see, ma'am.
Okay. So I was talking about the events that are occurring in the first stage. First week, isn't it? So that is only cleavage, morula formation, blastocyst, and starting of implantation. Okay, we will come to each of the stages. Before that, we will just go through this picture in which you can see the uterus and the fallopian tube near the. Can you see the cursor?
Yes, ma'am.
Yes. Okay, that is the ovary with the ovum released, and this is the fimbrial end which catch up the released ovum, and you have the ampulla, the infundibulum, the isthmus, and the intramural part of the fallopian tube. It is in this ampulla that the fertilization occurs by the meeting of the sperm that comes from the uterus to the ampulla and the ovum that comes from the fimbrial end. Okay. When the fertilization occurs, you can see that zygote. It is a large cell that is seen inside a particular covering. That is the zona pellucida. And the division starts from the 30th hour after fertilization. And you can see that still the zona pellucida is there and the cell division is occurring. And the initial zygote is a larger cell and it has to multiply within this limited space so that it attains the normal size of each cell. Okay. So the cleavage here occurring in human is holoblastic type of cell division. That means each cell, when it divides into equal two halves. But this is not the story when it comes to the reptiles and animals, not animals, reptiles and birds, where they have a lecithin-rich area called the lecithin-rich part, which has the nutrients stored for the development of the embryo. So as the lecithin is minimal in human, it is called a microlecithin oocyte. And as a result, in human, you have a holoblastic type of cell division. And as a division of mitotic division, the cells decrease in size and attain a normal cell size. And each cell, it is called a blastomere. And in this picture, you can see that the cells have decreased and attain almost the size of a normal cell size, and it is still covered with a capsule-like thing that is called the zona pellucida. So the first cell division occurs in the 30th hour, that is the second day. But the second type cell occurs in the second day, that is after the second day, that is 4 to 50 hours. So by third day, you have a particular stage of cell, that is 60 to 32 cell stage, that is called the morula. And this happens on 72 to 96th hour. And it has the word meaning morula means it is mulberry shaped. Still it is covered with zona pellucida. The zona pellucida has a particular function. Once the zona pellucida is zona pellucida disappears, the developing zygote has a tendency to get attached to the structure it come in contact. Okay. So this is the continuation where you have once the morula is formed, it enters the uterine cavity. And the cells in the morula will undergo a process called compaction. It is a process by which the cells get compactly arranged so that there is an outer cell mass and inner cell mass. The outer cell mass is having tight junction and are tightly packed. They form a layer of cells which are closely adherent to each other. Whereas the inner cell mass, they are loosely arranged. So that is compaction, and this compaction has an importance in artificial technique of fertilization in vitro fertilization. It is this compaction that is looked for selecting a good the embryo to get for implantation. Okay, and as the morula enters the uterine cavity, through the zona pellucida, some fluid will be actively entering into the morula, and that will occupy the space between the loosely arranged cells. As a result of this fluid collection, the morula will be converted into a blastocyst. The fluid that collects into the morula, it is also called uterine milk because it is the secretion from the uterine glands that enters the morula, and that forms the blastocyst. Now, as a result, you can see that this is the structure of blastocyst. It has a covering, the zona pellucida. It is an early stage, and the cells are arranged so that the cells at the periphery, they are compactly arranged, and the other one is loosely arranged, and you have a cavity which was initially multiple small cavities which coagulates to form a big cavity, and that cavity is called the blastocyst or blastocyst cavity. As a result, in the late stage of blastocyst, the outer cell mass will be converted to a single flat layer. In the second picture, you can see that the cell is converted into a single flat layer of cells, and the zona pellucida that was there in the early blastocyst stage is not seen in the second late blastocyst stage. And this inner cell mass, that forms the embryo proper. And those cells are called embryoblast. As a result, when you look into the blastocyst, you get a pole where you have all the embryonic cells aggregated towards one pole. That pole is called embryonic pole, and the other area it is called abembryonic pole. And there is a trophoblast secrete a early pregnancy factor, which is a protein that is secreted into the maternal blood during the first 10 days of pregnancy. So by analyzing that factor, we will be able to diagnose the early pregnancy in case of this precious pregnancy treatments. Those who are undergoing precious pregnancy, they can be evaluated by looking this early pregnancy factor. Next, this is called the disintegration of the zona pellucida, and that process is called the hatching of blastocysts. When the developing embryo with the zygote reaches the uterine uterus, some proteolytic enzymes are secreted, and that produce digestion of the zona, and the zona escapes through the defect. So that is called hatching of blastocyst. So when hatching occurs, that means next event occurring is implantation. So this hatching can be affected in some sort of infertility because of hard zona pellucida. And also, a premature hatching can lead to abnormal implantation in the uterine tube. I have already said that if the zona pellucida disappears, next step is implantation. So if it occurs in the uterine tube, it will lead to the tubal pregnancy. And sometimes you can see it is squeezing out of the zona pellucida. So sometimes half of it may come out and half may be stuck inside. This will lead to monozygotic twin formation. That is, the zona pellucida will disappear, but it will be disappearing later, and half of the blastocyst will be inside to get implanted later. Because of the pluripotency of the cells, it will form separate individual. This pluripotency is retained till the 16th cell stage. So here in this picture also, you can see that the zona pellucida, and you can see small cavities appearing between the loose cells. But later in the zona pellucida has disappeared, and you have the blastocyst and the inner cell mass. So you can see with the disappearance of the zona pellucida, the blastocyst also has increased in size due to the accumulation of the fluid. in this picture, what you see is the fertilization occurring at the ampulla. Then the dividing zygote is moving through the fallopian tube, and it is reaching the end of the fallopian tube by about 6 to 7, 6/5. Actually, it is the 4th day. After 2 days, it will reach the uterus for implantation. So, so implantation actually starts in the 6th to 7th day and continues till 12th day. So it is an event that continues from the starts in the first week and continues in the to the second week. So little bit of implantation also we will be dealing. So when you look into the uterine wall, you can see that this is the outer covering of the uterus, which is the perimetrium. Then you have myometrium, and then you have the endometrium. So this endometrium has so many layers. Endometrium, you have the surface, you have the stratum compactum, that is on lining the lumen, and stratum spongiosum, the middle part, and stratum basal towards the myometrium. So this is this stage is seen from the proliferative stage, secretory stage of the endometrium, that is just prior to fertilization. This will be the stage of the uterus. So when the fertilized ovum reaches the blastocyst reaches the uterus, this endometrium will be having a reaction known as decidual reaction. And as a result of this, you can see that the glands will become much tortuous. So I will come to that. So this is the next picture of implantation that occurs from the 6th day to the 10th or 12th day. And where is it implanting normally? It is implanting, where is it getting implanted normally? It is implanting into the posterior wall of the uterus. It is actually, to talk about, it is at the junction of the fundus with the body in the posterior part. That is the normal side, but anywhere in the upper segment, it is considered normal. So in this picture, what you can see is that implantation is occurring starting from the embryonic pole. It is the embryonic pole that is getting attached to the uterine wall. And there are certain factors that encourage adhesion of the blastocyst to the uterine wall. They are the secretin, integrin, beta HCG, and prostaglandin that is produced during pregnancy that help the blastocyst to get attached. Now, this is the wall of the uterus, and you can see this is the embryonic pole, and it is the embryonic pole that is getting touched with the uterine endometrium, and it buries into the wall of the endometrium. At the point when it touches the uterine wall, the trophoblast will differentiate into two layers. One is cytotrophoblast and other is syncytial trophoblast. The cytotrophoblast is called so because it is cellular, whereas the syncytial trophoblast, which is actually that is formed from the division of the cytotrophoblast, they multiply so fast so that it loses its cell membrane. So it forms a syncytial, that is called syncytial trophoblast. And what happens as a result of the syncytial trophoblast, it has a very eroding capacity. It erodes into the endometrium, and it goes deeper and get buried up in the endometrium. But that actually occurs in the second week. We'll show the next picture, which allows the blastocyst going completely deep into the endometrium. So I have said that the endometrium has an lining that is stratum compactum, the middle layer stratum basic. So it is in the stratum, in the middle layer is stratum spongiosum. So this blastocyst will be lying in the stratum base, base and stratum spongiosum. It doesn't erode the stratum base. Later, what will happen? The site where it through which it enters, it is filled up with a fibrin plug, and later the endometrium will be the lining of the endometrium will be covering that defect. So this is a picture of a late stage, a second week. So I am just dealing with the first week. And after implantation, the endometrium, it is called decidua. And for the decidua to happen, there will be some sort of changes, lot of changes occur within the substance of the endometrium. So in human, when the conceptus is completely embedded in the decidua, it is called interstitial implantation. There are other types of implantation, but in human, it is interstitial implantation. So we will go to the decidua. So decidua is the endometrium, but it is after pregnancy. Implantation. So in this picture, you can see the uterine cavity, and this light pink area, that is the myometrium, and the dark pink area is the endometrium. As a result of the embryo going inside the endometrium, it will have a covering of endometrium over the embryo, and also some endometrium will be seen towards its base. So that is the endometrium that after the implantation is called decidua, and the decidua is named as seen at the base, no? So decidua basalis. And the other one will be capping the developing embryo. So it is called decidua capsularis. Whereas the other areas, other than the site where the embryo is attached, you have the decidua. Again, you have a decidua. That decidua is called decidua paritalis. Are you getting that picture? Hello?
Yes, ma'am, it's clear.
Okay. So what is decidual reaction? So as a result of this sort of change from endometrium to decidua, there is lot of other that is accompanied by the structural changes in many of the constituents of the endometrium. So there will be increase in thickness of the endometrium as such, and it is due to the collection of fluid in between the endometrial connective tissue. The connective tissue itself swells up. The connective tissue cells will swell up. There will be accumulation of fluid that is secreted by the cells and also by the glands, uterine glands. The uterine glands will become screw-shaped. Already it is screw-shaped. It will become more tortuous. The cells will be swollen up with the glycogen and lipid. The spiral arteries will be tortuous and will be dilated. So this is another picture. This is the blastocyst. Blastocyst with the embryonic bone. The trophoblast is going to attach with the endometrium. This is the enlarged blastocyst cavity. Here, once it attaches, the cells, you can see the trophoblastic cells are eroding into the endometrium, and as a result, there will be more cells multiplying and occupying, going deep into the endometrium, losing the cell membrane. And this is not seen in the first week. This is the second week. As you can see that the embryo is also changing the features. The proper embryo inner cell mass is showing a change in the features. So here it is actually inside the endometrium, and you can see that the site of embryo, it is initially there will be a mucus plug. Later the epithelium will be covering it, and there will be a continuation of the epithelium. Now, if the implantation doesn't occur in the normal site, that is in the upper uterine segment, it can lead to abnormal implantation. It can occur in the ovary, or it can occur in any of the abdomen. It can be in the peritoneum or the pouch of Douglas. It can be in the tube, that is tubal pregnancy. It's a very dangerous condition because the embryo, once it implants, the blood supply will, blood vessels there will increase, multiply, and because of the limited space there, when the embryo erodes, the trophoblast is a eroding capacity. So when it erodes, it will lead to rupture of the tube, it will lead to fatal hemorrhage and even death of the mother. So that is the tubal pregnancy, ovarian pregnancy, abdominal pregnancy, tubal pregnancy. Then you can have a cervical pregnancy also. But all this are ectopic pregnancy, and okay, that is about the ectopic pregnancy, which can be intrauterine or extrauterine. This when it occurs in the lower part, lower uterine segments, it is intrauterine, and the others are extrauterine. Commonest type is the tubal pregnancy. Now, here when in this picture, I don't know whether it is clear, the implantation can occur in the lower uterine segment, and sometimes if implantation occurs at the junction between the lower and upper uterine segment, sometimes it may migrate, and at the time of delivery it will be in the normal position. That is the upper uterine segment. But depending upon the degree of descent of the placenta, there are various degrees for the abnormal implantation that occurs intrauterine. That is first degree, second degree, third degree, and fourth degree. In first degree, there will be dipping into the lower uterine segment, but the internal os will not be affected. It will not close the internal os. Whereas in the second degree, it will be almost reaching the internal os. In the third degree, it will close the internal os, but at the time of delivery, when the cervix dilate, the cervical canal will not be affected. The cervical canal will open up. But in fourth degree, which is the most serious one, here there will be, the placenta will be completely sealing that cervical canal. So in this situation, a vaginal delivery is impossible. So that is the fourth degree of placenta previa. So So this much is only I am having it now. For the first week, these are the events that occur. You have the fertilization, the cleavage, the blastocyst formation, the morula formation, blastocyst, disappearance of the zona pellucida, implantation starting, which goes further into the second week to complete implantation. As a result of implantation, the uterine endometrium changes its shape, name to decidua. The decidua has different parts: the decidua basalis, decidua capsularis, and decidua paritalis. There are endometrial changes that occur in the as a result of implantation, that is called decidual reaction. And you have intrauterine and extrauterine abnormal implantation. Extrauterine can be tubal, ovary, abdominal implantation, and intrauterine you have the placental previa, which is of different degree. So that is it.
Thank you, ma'am. Thank you for such an informative session. We now open the floor for question. Delegates, you are welcome to ask your doubts regarding the topic by unmuting your mic or putting your queries in the chat box. We encourage everyone to make this an interactive and enriching discussion. Please feel free to ask questions. Any question about the topic? Please feel free to ask. Ma'am, there is one question. Ma'am, time for DNA replication is with 12 to 24 hours. Please explain.
Once more.
Ma'am, Nandini is asking a question about DNA replication. She is asking whether it is within 12 to 24 hours. That's what I understood. Nandini, can you please explain it? Can you make it clear, please? Nandini, Sri Kannan. Okay, ma'am, there is another question. Like, ma'am, what are the factors leading to
Excuse me,
abnormal
ma'am.
implantation?
Ma'am, I'm Nandini Sri. Ma'am, in that slide you have explained that the fimbria and then stage 1 and stage 2 in which sperm and ovum get in fertilization, and in the third number you have explained the time of DNA duplication. Please can you
It is
explain that?
not DNA duplication, it is the cell division.
Okay, ma'am.
See, the DNA duplication, once after 30 hours, the first cell division occurs. So
Okay, ma'am.
that occurs before. The one cell stage is converted into 2 cell stage at 30 hours after fertilization. So that has to be, the DNA replication has to occur before.
Okay, ma'am. Thank you, ma'am.
Ma'am, there is a question from Deepa. Ma'am, what are the factors leading to abnormal implantation?
Okay, there are a lot of factors. anything that delay the transport of the fertilized zygote into the uterine cavity. It can be the sperm is a small structure compared to the ovum. So sperm may be able to reach the ampulla, but the fertilized zygote will not be able to reach the uterine cavity. It can be a narrowed, or the epithelium that is lining the endometrium may not be proper. All this factor can lead to the embryo getting stuck there. The fertilized ovum gets stuck in the tube. It is the cilia of the fallopian tube and the contraction of the fallopian tube that allow the zygote to reach the ovum. So that can be a factor. Then I have already said that zona pellucida, if it doesn't disintegrate in the proper time, it will lead to implantation in the cervical region or somewhere else. Or it can be the fimbria. It may not be taking in the ovum into the fallopian tube, and the sperm may be entering into the abdominal cavity, and it may be fertilizing in the abdominal cavity, or when it is attached to the ovum itself, it may be fertilizing the ovum. Okay. Or the zona pellucida, if it is getting disintegrated early, it can lead to the fallopian implantation in the fallopian tube and tubal pregnancy. These are some of them.
Okay, thank you, ma'am. Ma'am, there's one more query. Can any specific nutritional deficiency cause the problem in the process of fertilization or implantation?
Yes, of course, because a normal function needs all the nutrition to be in balance, no? I don't know which nutrition, but celiac reaction, the contraction of muscles, the tone of the muscles, everything need an adequate nutrition. All this can. But to fertilization to occur also, the nutrition should be adequate. And normal endometrium without anemia, all these factors will come, no? Fertilization and impact, the event of fertilization, the factors are different. The factors for getting implantation is different. If the hormonal, all these are different, the fertilization may occur, but implantation may not occur. Is it okay?
Okay, thank you, ma'am. One delegate has raised her hand. Ms. Sapna, can you unmute your mic? Or you can put your query in the chat box. Okay. Ma'am, what is implantation process in twins? That's what the question.
Okay. The twins are of different types, monozygotic twins and dizygotic twins. Okay. In monozygotic twins, I said the morula has pluripotency. So each cell has an ability to develop into an individual. So in monozygotic twins, at what stage that two groups come? That is the implantation process and all is same. That placental formation, everything is same. Your question is, how is it different, no?
Yes, ma'am. I think it was the question, how it is different.
It will be the same, but the formation of each layer, the covering of the embryo, the fetal membranes, that will be different. The process of implantation will be same. the syncytial trophoblast that is forming, the consequence of placental formation, everything will be seen. The fetal membranes, that part will be different.
Thank you, ma'am. There is a question on Ayurvedic analysis, but it will be addressed in the upcoming section. So any more queries left? Are there any more questions or clarifications regarding the session? Feel free to ask.
I think the
Seema,
session was very clear, and the only thing that to follow up with or catch up with the following sessions by embryology on embryology, my ma'am, everyone have to be thorough with this first week, and then only we can build up the next on that. So
next week onwards, but next week onwards it will get complicated. So if you don't keep in, don't look into the subject, it will be a confusing. You won't be able to follow. First week and half of the second week will be okay. After that, all the complication will arise.
Yeah, so
won't be able to follow first week. Okay. Second week, starting it's okay. Third week onwards, there's a question: bicornate uterus, how will it implant? In bicornate uterus also, the endometrium will be there, but there will be only limited space. Implantation can occur, but survival of the fetus, that will be difficult.
Seema Sunil has raised her hand. What's your query?
Thank you, ma'am. Okay, thank you, ma'am, for a nice presentation. Ma'am, my question is, in a normal course, on which day the zona pellucida will disappear?
Zona pellucida will disappear by 5th day.
Okay, thank you.
Zona pellucida will disappear by 5th day. Soon the implantation starts by the 6th day and it will end by 12th day. So some book says 6th to 7th day and implantation completed by 10th to 12th day. Is it okay?
Okay, thank you, ma'am. Bharati, do you have any query on the topic? Please unmute your mic.
Can you explain the Ayurvedic view of sex determination, that is Artava and Shukra? When Artava is more, they say it is female. And
Excuse
when,
me, sorry for interrupting in between. Ma'am is allopathic doctor. She is she's a associate professor of Department of Anatomy. Okay, your questions will be addressed in upcoming sessions. We all have okay. Upcoming sessions are about Ayurvedic things.
Okay. Thank you.
Any more queries? It seems there are no further questions at the moment. Ma'am, one question.
Could you please knowledge about uterine milk? Okay. So when the morula reaches the uterus, reaching the uterus, it is actually the blastocyst that is reaching the uterine cavity. The uterus will be, the uterine endometrium will be in a secretory stage with the gland secreting fluid. So this fluid will be entering through the zona pellucida into the morula to separate the cells of the morula. So initially, I told you that the morula, in the periphery, you have compact cells, which is tightly arranged, and inner you have the cells which are loosely arranged. So through the zona pellucida, so through the outer cell layer, this fluid will get inside and separate this group of cells. They go in between the group of cells initially. And finally, the inner group of cells will be moved to one pole and the fluid will accumulate. It is actually the secretion of the uterine glands that enters into the morula that forms the uterine milk.
Thank you, ma'am.
Did you hear me? It's okay, no? That answer? Uterine milk, is it clear now?
Yeah, ma'am, it's clear.
Ravindra, hope you understood the concept. Thank you for the question. Any more queries? Dr. Seema Sunil, do you have any? Oh, ma'am, there is another question. Ma'am, other than family history, what may be the reason for multiple pregnancy, usually triplets?
Nowadays, triplets are more common because it is the assisted reproductive technique that is producing so many triplets now. Family history, other than that, our diets itself may be a reason. They're having lot of twins nowadays, no? First thing is the infertility and its treatment. The triplets, it is the clomiphene citrate, all the ovulation inducing drugs, no? They have a complication, a side effect, it is said twins pregnancy. So there was a question, what are the other blood tests? There's the same thing, that factor can be tested using here. One test is there. Rosette inhibition test. Rosette inhibition test. That is the test that used for the first 10 days of fertilization to look into the EPF factor.
Ma'am, there is another question. In case of non-receptive endometrium, which phase of implantation get hampered?
Which phase? For implantation to occur, the endometrium should be in the proliferative phase. So it is the proliferative phase. If it is not in the proliferative phase, that ovulation itself will not be occurring. No, after ovulation, only the proliferative phase will happen. I didn't get actually the question. Once more the question.
Ma'am, in case of non-receptive endometrium, which phase of implantation get hampered? That was the question.
What is the phase of implantation?
Dr. Farsina, could you please make it clear, your question?
If ovulation has occurred, if the zygote is formed, if the uterus doesn't have the endometrium to receive the blastocyst, then there is the implantation won't occur.
Thank you, ma'am. Any more queries left? It seems there are no further questions at the moment. I hope all your queries have been addressed.
Yeah. Yeah, I think we have addressed almost all the Q&A. We are extremely thankful for you, madam, for that very simple and crispy elaboration of the topic. We do realize that today's topic was very basic, and after all, the basics should be very thorough to build up the further layers over that. So I think every delegate will keep revising the topic and updating that every day. Ma'am has promised to take 2 sessions every week for the next, that is total 6 in total. So it's our duty to keep that exercise with that completed topics and keep it updated. Thank you, ma'am, for the presentation, and thank you, delegates, for that active participation as well.
Thank you, ma'am. Thank you for the
Thank you very
informative
much.
session.
Thank you very much. Thank you. See you
With
again.
that, we come to the end of this enlightening session. On behalf of everyone here, I extend our sincere thanks to Dr. Geetha ma'am for sharing her expertise and valuable insight with us today. Thank you, ma'am.
Thank you. Thank you.
I would also like to thank all the delegates for their active participation and engagement. We look forward to seeing you in the next session. Until then, take care. Good night.
Thank you. Thank you very much. Thank you.
Thank you, madam.
Thank you, madam.